personalised care programme has made a big difference to my life.
I have benefited hugely from a personalised care approach.
The outcome that I've had for my daughter, I'd like that to be duplicated everywhere.
I'm just so happy someone's finally listened to me and what I want.
I am the expert. A patient is the expert to what they're feeling.
Now I have got choice on what happens in my life.
Called ankylosing spondylitis. It's quite a complicated condition, and I always try and say to people, if you just look at it as a form of arthritis.
I received my kidney transplant 3.5 years ago after experiencing kidney failure as a result of an autoimmune condition.
My daughter Hannah, she was diagnosed shortly before her first birthday with a chromosome abnormality, and basically it's ended Hannah having severe learning and physical disabilities.
I weighed 130 kilograms, 20.5 stone, and I had health problems caused by my weight.
In August 2011, I had a fall down the stairs and it resulted in a C5 spinal injury and was told that I would never walk again.
I was diagnosed with dystonia in 2006, but I fell ill with it in 1989.
After coming out of hospital, I was put with a care company. They would send staff in that didn't know the first thing about spinal injuries, and there was no control for myself on my life, and it just put me into more depression.
Those appointments prior to getting that diagnosis have been really, really challenging. I used to come home crying all the time, feeling like I'd just not been listened to.
This was the first time I'd ever been in hospital as an adult, so I had pretty much no idea what to expect. Obviously I was physically there at the hospital and I was the one who was feeling unwell and having the tests, and at that stage sitting in the consultation room being discussed.
Before we had a personal health budget, we had care agencies coming to us to look after Hannah. Varying results, so it wasn't great.
Seven years ago, I was given a lifeline. I was asked if I wanted a personal health budget, which I jumped at the chance. I have 12 PAs at the moment, and they are my arms and legs, but never my voice. My life is now my life.
When I got my diagnosis eventually and saw my consultant that I'm with now, everything changed dramatically for me. What it was just an entire shift in relationships. He respected my knowledge and my expertise. After all, I'm the one with the condition.
In the end, I think what made the biggest difference to me overall was the realisation that even though my kidney disease is going to be lifelong, what I could do was have a great deal of influence over how I chose to manage it and how I chose to cope.
Since having a personal health budget, we ended up choosing our own PAs. We had control of who came into our house finally.
The new consultant, totally different person, doesn't look at me as though I'm an illness. He looks at me as though I'm a person and treats me on an equal level.
I went to my doctor and he referred me to the local obesity service. I was introduced to the patient activation measure.
Part of the Lancs and South Cumbria co-production group and the National Strategic co-production group is a fantastic opportunity for me and all the other people that are on there to help champion this and get this message out there.
I really hope that I'll be able to use the positive experience that I've had to work within co-production groups on both a local and a national level to speak to a very wide variety of medical professionals and be able to encourage them to understand the real impact that they have and the opportunity to be a very positive influence on the lives of patients that they meet.
If they're bolder, more imaginative and treat patients how they would want to be treated, we will have better outcomes for everybody.
If I didn't have a personal care approach which worked for me, I think I would be dead now. Now I am in control of my life and health. I expect to live a long, happy, healthy life.
I'm quite honoured to be part of the Let's Get Personal team. It means that I can get the message out to fellow patients, to doctors, consultants.
I'm really passionate on letting everybody know about personal health budgets, and I would like to think that in the future it would make other people's lives better for them.